We are back and we are looking at hypothyroid patterns, and we've already covered two very common causes of hypothyroid conditions. One being Hashimoto's, which is an autoimmune condition where the immune system is attacking the body, specifically the thyroid, and producing a hypothyroid function. The second one is a hypopituitary function, where when we were looking at the TSH numbers, it would normally indicate a below optimal range of below 1.8, and if all the other test markers were normal or even slightly low, it could possibly indicate that the pituitary, which is responsible for sending the thyroid stimulating hormone to the thyroid, that the pituitary may not be doing its job. So there's some things you can do. We talked about the stress being a major cause of that, and hormones tied into that. So those are the first two things we talked about, the immune system and also the pituitary. Today we are going to look at another common cause, and when a lot of people get their thyroid tests done, unfortunately the only thing that normally gets run is this TSH number right here, which is obviously the hormone from the pituitary that tells the thyroid to make T4 and T3. And one of the things that can happen is if your TSH is above 3, remember the optimal range is 1.8 to 3, say if your pituitary number was 4.6, your doctor may decide to put you on Synthroid, which if you don't know, Synthroid is the most prescribed drug every month, with over approximately 22 million prescriptions every single month for an underactive thyroid. So it's very widely used, and a lot of times people will be put on this if their numbers start creeping up and outside of even the lab ranges. However, I want to ask a question today. Is Synthroid always necessary? And as we go through this, we're going to find out that in a lot of these cases, it's not a Synthroid deficiency. And we're going to take a look at what else can cause the body to not produce the T4 and T3 where it should be. And one of those major causes is gut issues. Now, there's a lot with the gut. We won't be able to cover everything right now in regards to thyroid. I just want to cover a few points here of how the gut can influence specifically your thyroid, but the thyroid stimulating hormone as well. So for one, at the end of the line, the end game is we want to get our T3, our usable form of the thyroid hormone, up. And one way we do that is by the conversion of T4 to T3, which 20% of that conversion happens actually in the gut if you have good bacteria present. So right there, 20% of this T4 to T3 conversion happens in the gut. We already talked about in the first little video how the gut actually holds about 80%, most of our immune system. Over half of the immune system is located in the gut. So whether you're dealing with Hashimoto's or even Graves', or trying to get more conversion of T4 to T3, the gut, right, for that reason alone is really important. But we're going to actually look at some other key things that the gut is responsible for. And when I'm saying gut, I'm using it in a very broad sense. I'm talking about almost the complete digestive tract, from mouth all the way to anus. And one other key area that's very common with hypothyroid people that are suffering from a low thyroid function is pH issues in the stomach. And I'll explain why this is important. But on a pH scale, your alkaline substances are really high, 14, and your acids are really low. Now, a lot of people that have heartburning symptoms and stuff like that may think they have too much acid in the stomach. But in reality, most people are actually they're not producing enough acid, or they're not getting it low enough on the pH scale to actually break down their food. So the food is like sitting there and rotting in their stomach, and it's actually getting burnt back up, bloating, belching, and all those type of symptoms happen. And it's very common with people with hypothyroidism and hypothyroid conditions to have low stomach pH, or I should say high stomach pH and they're not getting it low enough to actually break down their foods. So you have to get your stomach acid down to 3.0 to 5 in order for HCl and pepsin to be activated, which helps break down protein. Well, why is that important? Because the precursors to thyroid hormone, like tyrosine and a whole bunch of other minerals and vitamins and things like that, tie into the breakdown of protein in different foods and things like that. So it's really important to get that pH low enough so you're breaking down and making your neurotransmitters, your enzymes, and things like that. So this is a very important part of digestion, is getting that pH low. And here's one quick tip you can do to actually help that, is during mealtime, try to reduce the amount of fluid. Actually, it's probably better just to cut it out during mealtime. Maybe drink before meals and after meals, but you want to try to get your pH as low as you can during the mealtime, and that way you're not messing up the pH and not being able to break down your proteins and fats. And a lot of people will end up having to, for a little bit, maybe use even HCl or even enzymes before and after meals and stuff like that. There's special timing for all those things. But this is a huge thing when it comes to thyroid function and optimizing assimilation of nutrition, because a lot of people are eating healthy, but they're not assimilating what they're eating, and this is a major reason why right here. I'm not going to go into this third point about the gut, but like I was saying earlier, I should say, I'm not going to go into detail. The gut is responsible for the immune system, and how we can develop an autoimmune responses if we start having what's called a dysbiosis, an imbalance between the good and bad bacteria. It can create a condition where our gut wall, which is very thin, can be compromised, and we can have a leaky gut where the particles are passing through and into the bloodstream, and the immune system tags that item, whatever it may be, and you're starting to develop an immune system response. And this is how autoimmune conditions can definitely start and cause a lot of problems. So those three things right there, the fact that the gut is responsible for 20% of the conversion of T4 to T3, the fact that the pH really needs to be in the right ranges for you to break down your food, and the fact that the gut is where the immune system really is tied into, especially with secretory IgA. It's really important that we consider the gut whenever we have a TSH level above the 3. And and a lot of people go, well, is there any other alternative to Synthroid? And yes, there is. Actually, there are healthy alternatives that are safe and actually clean. A lot of people have issue with pork-derived products, for one, and those things can be taken. There's also some herbal things that can be taken too. But really, the point is that may be a temporary thing, and really addressing root causes are pretty foundational. I want to make one more mention. It's kind of inappropriate too if you're only looking at TSH and determining that the T3 and T4 are low based off a high TSH, because you don't know if you don't test. And a lot of people assume if they have a high TSH that these numbers are low. It's not always that way. So a comprehensive assessment is needful, and to basically rule out any autoimmune conditions and to see what else is going on. I'm going to provide a link below with appropriate testing and obviously a program that addresses all these different issues, plus natural means to take things that can definitely get all these markers and things that aren't even on here in the proper balance. Check out the link below for more information.